Okay. If you had something you want to start with, but I'll just ask kind of what do people need to know about getting tested right now? What specifically is the process we're doing this morning?
Sure. So right now we're out at the Mahalia Jackson Theater in Armstrong Park. We also have a site at UNO Lakefront Arena where we are doing drive-thru testing for symptomatic individuals who are over the age of 18. So to qualify for testing at these sites, you have to be symptomatic, which means you have a fever while you're here on site. You can have a self-reported fever with additional symptoms such as cough or shortness of breath.
Can you illustrate, please, for anyone, because I know there's a lot of people who are scared, frightened, maybe a lot of people may not be showing symptoms, or their kids maybe not showing symptoms, and they still say, I want to come get a test anyway. Illustrate why they cannot do that right now.
Yeah, so unfortunately, because the test kits are so limited and laboratories are strained to get test runs, it's really important for us to leave the test kits for people who are experiencing symptoms. Those are our highest priority. So as you know, we opened 2 days ago just for healthcare workers and first responders, because we need to get those workers back to their jobs, back to hospitals, back to their ambulances so that they can continue to protect the rest of the community. So we really encourage our highest risk individuals, those who are elderly with pre-existing conditions, to get tested.
Can you just sort of give us an idea of what this week is going to look like? I know this is just the beginning of getting testing. Can you kind of give us an idea of what you expect this week?
Sure. So right now we have the capacity to do 250 tests per site per day, and that's because that's how many tests the lab can run each day. And so we don't want to create a backlog, and we want people to make sure they get their test results in a timely manner. So every morning at 8 a.m. we will open at these two sites in Orleans Parish, the Mahalia Jackson Theater and UNO Lakefront. Jefferson Parish is also running a site out of the Ilario Center. We will open at 8 a.m. each morning, and we will take the first 250 people who meet the criteria, and once that's done, we'll announce in a NOLA ready text and through social media that we are done for the day. If someone is unable to get tested here, we are providing handouts of other testing locations around the city.
And how does it work if they go through and getting testing? Testing here is free, correct? But as you said, it's limited. If they find out they do have it, how do they find out? We asked this the other day, but do their healthcare providers, are their insurance providers find out, or do they just get a call themselves?
Sure. So here at the site, testing is free. We are not collecting any health insurance information. You do have to have a ID with you to show that you are over 18 and a Louisiana resident. So you would show your ID is the first step. Then you are triaged to make sure that you are symptomatic. After that, you will be registered. We will collect name, date of birth, address, and phone number, and make sure that you consent to being treated. Then you'll actually get your nasal swab completed, and you'll be given a fact sheet with information about what to do next. Within 3 to 4 business days, you will get a phone call from a 1-800 number with your test results, so that your test result does not come through your normal doctor or your insurance. It will come directly to you from that 1-800 call center. Those results are also shared with the state health department.
And are people turned around, basically, if they come through, if they're feeling under the weather but they don't have the proper symptoms to go on to the next stage, which is the tent over there? Are they simply turned around and told to basically go home and just self-quarantine?
Yes. So if someone comes through and they do not have the symptoms that we're looking for, again, a fever on site or self-reported fever with a cough and shortness of breath, they will be redirected out of the testing area, and they'll be given information to stay at home or other testing locations, or instructed to call their primary care provider.
Do you expect more testing to come online here as we get more and more into this?
We do. So over the past week, we've seen a wide variety of healthcare providers open up testing. So a week and a half ago, the only option was to go to an emergency room. We now have drive-thrus at most of our major hospitals. We also have a lot of community clinics, healthcare for the homeless, Daughters of Charity, Crescent Care. Crescent Care even has their own drive-thru and walk-up available. So, and there's a long list available at ready.nola.gov where you can find other testing sites. The other thing I'll mention is that this site is intentioned for cars only. We are working with some providers to determine if it is feasible to do a walk-up, bike-up option over the next week.
And can you just describe a little bit about what's happening here? You got the National Guard, NOPD, a lot of different officials out here. Can you just describe to people what's going on?
Sure. So here at the testing sites, they are being run by the New Orleans Health Department in conjunction with the Louisiana National Guard. So NOPD is assisting with traffic control around the sites, and then the actual stations inside the facility, triage, registration, and testing is a mixture of National Guardsmen, New Orleans Health Department staff, and our New Orleans Medical Reserve Corps volunteers.
And is social distancing still the name of the game for the general public outside of testing? I mean, we're under a shelter or stay-at-home mandate. Is that still the mandate as of right now?
Yes. The best thing that everyone can do is to stay at home and to limit interactions. Even if you are just feeling generally ill, you might just want to stay at home if you don't have a fever and qualify for testing. Stay at home as much as possible. If you're healthy, we're also asking that you stay at home just to limit interaction and limit the spread of this virus.
I know that you guys end at 6 p.m. or until the 250 tests run out. If you're the car that gets the 251, you're the 251st car to try to get through. There's no queue section, like you won't get first come. It's first come, first serve every day.
Yeah, these sites are first come, first serve every day. So when we start getting close to our 250 cap, our staff will start coming out in line, picking the last car that's going to go through, and providing a flyer with other testing locations to the rest of the cars in the line.
Is there anything you can just say about people's patience and kindness in a time like this? I mean, I know a lot of people are sitting at home going stir crazy. Is there anything that you can say just to reiterate that message?
Yeah, we really appreciate everyone who is taking quarantine and trying to find ways to have fun at home. We also, this morning, we have long lines at both our testing sites here in Orleans Parish, but people are being patient. There's no honking. No one seems angry. They are moving through steadily, and we really appreciate everyone doing that.